Retinoblastoma is a cancer of the retina, which is the back of the eye, the inner lining of the eyeball. And it most commonly happens in children who are 3 years and younger. And a common way people might suspect that the child might have retinoblastoma is when they look at the pupil. That small black spot in the center of the eye called the pupil. If it looks white, either when you look at the child or when you look at the child's photo, their picture, or if a child complains of, eye pain, you notice swelling of the eyeball, the child is having a squint, when what we call four corner eye, one eye is looking straight, the other eye is bent, or the child is having double vision, what we call diplopia medically. If a child has or complains of any of these, or you observe any of these, you need to be taking your child to the doctor immediately, because it could be retinoblastoma, it could be something else, but it could be retinoblastoma. And what your doctor would do, like I'm a family physician, what I'll commonly be doing is I'll examine that child, confirm whether there is white, pupil, leukocoria or not, and check other symptoms and other signs, examine the child thoroughly, and then determine whether I need to be referring that child immediately or urgently to the eye specialist, the ophthalmologist, who will then, run some tests. They might do some ultrasound of the eyes, some MRI scan, some other investigations, MRI scan of the eyes, the brain, confirm that diagnosis. And when they confirm that diagnosis, the next thing they'll have to discuss treatment. And treatment could be things like, using cold therapy, cryotherapy. They might have to remove the eyeball. They might have to do radiotherapy and some other forms of treatment, depending on the size or what we call the stage of that retinoblastoma. That's usually what will determine, the kind of treatment, whether they're able to spare that eyeball or whether unfortunately the eyeball has to be removed. So the most important thing, the reason for this video is for you to recognize early signs, warning signs of possible retinoblastoma, and for you to seek medical help immediately if you suspect your child might have any of those signs or symptoms.